first for starters, I believe this could be the simplest way that we can have the plan, to develop the quality improvement plan. So there are four simple steps that I see. The first, you create a team. Then we need to gather info and assess uh, previous QIs, develop a plan, then implement and evaluate. So let's do this step by step. First, we need to create a QI oversight team. So what does a QI oversight team uh, consist? So we need to identify key leaders and staff to be in the quality improvement team for the health department, ideally. No? These individuals should have training, knowledge, and experience, and with QI, but a minimum. It's okay lang a minimum, and we need to have these group of people who are committed to leading QI efforts and helping others to involve and be interested. Kay it's hard to start a plan, no, with members na dili they motivated to help an organization. So it would be useless, I believe. The typical size of this team is 5 to 10 members. So it may be the members of the team may be an ongoing leadership team or a mix of leaders, managers. So it could be a mix of anyone in the organization. Okay, as we know, if the organization is big, there is gap in between the communications in the top level and the lower levels. So it would be helpful for a team to be composed of those different levels in the organization. So what are the QI team responsibilities? They will learn the QI methods. Some of the members will have no idea of how to do a quality improvement plan. So they need to learn the methods, evaluate the plan annually. So this is not just a short-term plan for an organization. This is a long-term plan. And they need to be supportive, they need to encourage supportive QI environment. So they will be the one to promote this plan, promote the activities, and selecting and supporting agencies for the QI projects. So this team has for some they have this tip that have terms for team members. So for a team, it doesn't have to be them for the whole 10 years. People come and go. Some of them might be like just 1 year in the institution, so it's difficult to hold them because they're a member of the QI team. They can be staggered when members leave the team. So have team members with QI experience from different environment. So some may be new to your organization, but then in the previous organization, they experience um, formulating and developing a QIP. So it will be helpful for the team and for the whole organization as well. So question is, can a frontline staff join a QI team? What do you think?
Yes, I
Yeah.
think as long as there's no conflict with your schedule, I believe.
Yes, ma'am. Thank you, Ma'am Rod. Yes, as what I've said a while ago, it is effective for the team to have a representative from the different levels of the organization, so that different levels of the organization, different groups will have their voice for the improvement plan. So the second step could be the gathering of information and to assess the QI maturity. Gathering information, this one is for the first, I believe this one is a first for the first QI planning. Katong wala pa kasuway og QI planning, they have to gather the information first. Gather information on what QI activities, efforts, and work have previously been implemented at the health departments, because unknowingly we have developed some activities for the whole hospital's improvement. These do not have to be formal QI projects, but can be other efforts to improve the work of the health department. Yes. The purpose of this step is to assess whether the health department currently is in terms of QI efforts and process. This will help with the writing of the QI plan by outlining the structures that they have been doing for the previous QI activities. So you need to gather the information on the QI activities that were implemented. Um, for assessing the QI maturity, this is for those organizations who have, I believe, already started with their QIP. It is important that the oversight team have a sense of department's commitment to quality improvement and how it relates to organizational goals. So, developing a culture of quality in the organization goes beyond conducting individual QI projects. This typically takes over time. So, the the assessment is not required, but can help the QI oversight team in identify key areas to focus efforts, set organizational goals around the QI. So, if the QI oversight, sorry, if the QI oversight team or health department leadership decides to do this assessment, there are a few options. So the key leaders at the health department completes the assessment survey, QI oversight team completes the assessment, or all the staff. So the assessment is from the top. The assessment of the organization is from the top, or let's say from the bottom level of the organization, the team and top leaders who are not involved in the team. So assessment could be using external tools. There are tools that I have seen in the uh, internet. So some have developed a tool over time in developing a QIP. So uh, for for me that for me who has not been able to like see or witness this QIP, it's quite complicated, but I believe there are more simpler ones. So, a quick question also. Can you share a QI activity in your current setup that you think needs to be improved? Let's say you have this activity, then mamantay man jud ta know if how the activity was organized or who made the activities na moingon ta example for a simple anniversary ay ano yung tato ilang gibuhat or yung ano yung tato it was better to be like this. So what have you experienced in your organizations? Anyone?
I think process flows lang, Ma'am Giselle. There are some process flows that needs to be improved for it to be more efficient. But with regards to a QI activity per se, actually I'm not aware because I am not a member of that QI team. But based on my observation, ano lang, process flows lang na need siya ma-improve. So needs quality improvement.
Mm. So mostly no for I believe your institution, Ma'am Rod, is turning 5 years. ARC is 5 years.
4 years.
Oh, turning 4 years. Yes. So for a let's say bata pa nga institution, no? So with us na just turned 6. So there are different revisions of the policy that are done over the past 6 years, and sometimes if dili jud siya tutukan, if di jud siya i-assess over time if it's effective, then dili jud mag-improve ang organization, and I have witnessed that.
Yeah,
And
true.
sometimes You will hear from the staff na lang nga maingon nga, unsa man ni, uy, 5 years na ta and it's still like this. So sometimes it's murag saksak sa likod na it boils down to managerial, supervisorial levels nga why are some of the departments are not improving, or some of the processes and workflows have not been revised amidst the gaps that they have noticed. So yeah, we'll learn from this. Ma'am Kim, I am sorry, Ma'am Rod.
Yeah, true, Mom Jess.
So moving on with the next step, the third, is the development of the QI plan. So this will be quite a lengthy one, and there is a more, let's say, detailed. I saw some resources in the internet, but this is the simplest one that I can discuss. For the development of the QI plan, you take the information gathered. So we have done the assessment. You will take the informations gathered and write a QI plan. The next step is to take the information, outline the process and foundation for the QI of the health department. So you need to identify the current performance and baseline, review the priority indicators. Then next is you need to create a plan. Then we need to make a narrative or progress note. So that's what I have seen in the resources that I have searched. It's more of uh, somewhat the same sa research paper. And the sign-offs are like the signatories of um, the the organization. Uh, those people who approve. Once the QIP has been approved by the board, the quality committee, and the key senior leadership, so they need to involve to sign off, or just the important component to help demonstrate the shared accountabilities and responsibilities for QIP. So, naay signatories for those persons who nag-approve sa QIP. So, a tip on this step is start where your department is at. So we don't need to have it in a very massive plan. Maybe for some of us, we need to start with siguro kung sa barangay, let's say on the um, barangay setting, we need to, di ba, nanay purok and barangay, and then on a town. So let's start on a smaller group for the plan. QI plan should be useful and relevant and should be updated annually. So let's dig in more on the narrative. So a narrative allows the organizations to provide context for the information in QIP. So narrative should include the following: an overview that includes the objectives of the QIP for the following year. So, as what I've said a while ago, it's not just a short term planning. For some, they have published a 3 to 5 years of planning in their QIP. Then it should also include how your QIP aligns with other planning processes in your organization. So it would be difficult na your QIP for your department is not in line with the hospital, or let's say your bigger organizations. So for example, the strategic plan, operational plan, and other um, other plans that you have for the organization. Then the narrative should have the description of how the organization is working with the system partners in developing Yeah, in developing and executing quality improvement initiatives to improve integration and continuity of care to your patients. So there could be challenges, risk, and mitigations, but it needs to be included that have been identified in the execution of these quality commitments and how these will be addressed. So that will be shown in the narrative of a QI plan. So another one is the extent by which your organization is using its information management, example your medical records, to better understand the needs of your patient, client, or resident populations, and to inform quality targets. So it is through your data. You can also um, uh, get some informations on how to improve your organization. And next is understanding of how your organization is engaging its patients, clinical staff, and broader leadership in establishing shared quality improvement goals and commitments in the organization. This should also include how an organizational leadership will be held accountable for achieving the targets set out in your QIP. And um, so this sign-off section that verifies leadership. So that's the narrative must include sign-off section that verifies leadership. That's what I said a while ago. The signature of the chief of staff, the lead, and whoever approves the plan and is committed to its implementation. So um, once the organization has already established a plan and have they have been using this they have been using the QIP for some quite some time, it will just be a cycle. So from planning the strategy where they identified a goal or a purpose, and they will then develop or test the strategy from the previous QIPs that they have done. So um, there is evaluation from the previous QIP, then they have to develop a new strategy. The components of the plan are implemented, and then monitor the new strategies that they have developed. So this is a study. This step involves monitoring outcomes to test the validity of the plan for signs of progress and success, or problems and areas for improvement. So uh, coupled with some tests results and some assessment. So this will help you on which other parts to improve. Next is to use learning to adjust the goal and change the method. So this will just be a cycle. This is the simplest most common process of QI planning. So it will just be a cycle, and as what I've mentioned uh, early in my report, it is a living document that after the end of a plan, you will just then see some other root causes and then start for another QI plan. So I have another question. Why is good planning important to quality improvement? Can anyone answer aside from Ma'am Rod? Daghan na siyang points. Can anyone share aside from Ma'am Rodora? So why do you think is good planning important to quality improvement? You can relate that on your own organizational setting. Yes, Sir
Yes,
John.
ma'am.
Ah,
Oh, Sir John lang, sige.
ay, sige.
Ikaw lang sa Ma'am Lynette.
Nag-ilog na noon sila.
Yes, Ma'am Jess, good planning is important because you cannot come up with the quality improvement if you don't have a plan. So the first thing to do is you have to plan in order for you to have the quality improvement.
Yes. How about you, Sir John? Ma'am Emj. Hi, Ma'am M. Sorry, Sir John, sila na lang sa kining volunteer. Asa to si Ma'am M? Yes.
Yes, hello, ma'am. Good afternoon, everyone. I could say, a good planning is very important in quality improvement, especially QIP is a plan in the first place. I could say that, like what some in my report, no, previously in a different subject. When you say planning, you plan things ahead. Without a plan, there's no clear direction on where are you going or in what direction your organization will be. So in order to have a good quality improvement for your organization itself, you must to set a plan or direction in what area you think your unit or your department needs to improve. Like for example, in my experience, I work in a unit in a specific hospital here in Ormoc City, and I could say the quality improvement plan is not well implemented. That's why I think the QIP in our unit is actually questionable to say no, because uh, there's no quality improvement happening in our unit back then when I'm working there, because there's no checking on the equipment, there's no regular maintenance for the equipment, and trainings for the employee actually is really not part of the plan. When you say quality improvement, it's improvement not only for the staff but also for the what do you call this one? For the equipment that we are going to use, not to provide their services to our clients. So I really think that setting a good plan, it's making a good direction for the quality improvement in the totality of the organization itself.
Yes. Yes. Well said, Ma'am M. Yes, Sir John.
Just to add sa gisulti ni Ma'am M. Jomelo, um, the planning as a whole is an important process because this provides the top management of an institution uh, the needs to make effective decisions on about how to allocate the resources of the organization in a way that will enable them to reach their objectives. Productivity is also maximized and resources are not wasted because uh, they can focus their attention on the objectives and the results that they want, and it also establishes a basis for teamwork and again, also provides guidelines again in decision making. Thank you.
Yes. Yes. Thank you, Sir John. So, yeah, that was a good addition to the slides that I have here. Um, Good planning is, I think, where we are right now, especially science, and we have here the full online masters is a start of a good plan, I believe. So, um, everything starts with planning, and good planning um, results to innovations and what other important things that we have right now. So, let's move on the fourth step, which is the to implement and evaluate. So within the written QI plan, the health department should have developed a work plan action or action uh, work plan or action plan for how to implement the work needed to meet the goals. So once the you have implemented the plan, remember to track the progress in all areas. So how the training went, how the communication went, how the staff received the activities, the trainings, and whatever feedbacks we have with the plan, we need to report it to the stakeholders or the people who are involved with the revision or the let's say the effect of the plan or the response to what they implemented. So um, as progress is monitored, report to key stakeholders as needed or desired. So outline how this will be done in the communication plan. Along with this, share lessons learned and celebrate success. So it's not just about looking for loopholes. So it's not just about say kuwang daay what was their negative feedback, what do we need to improve. So it's also just um, celebrating that there is also positive feedback on the plan that we have done. This can be done through storyboards. So um, the QI plan should be reviewed, evaluated, and updated annually by the QI oversight team. So another question is, in your current setup, can you cite an example of a plan that has improved after an evaluation? So uh, let's say I think this is quite similar to the previous question a while ago, but if you can cite a plan that was made in your setup in your organization, then did you see any improvement after a specific evaluation? Yes, anyone? Yes, Ma'am Rod.
Yeah. This is, I'll just talk about the process flow. Like for example, in our ER, because we have patients actually, because we get patient feedbacks. By the way, for us to know how we could improve our processes and all, aside from the quality improvement plan that our management is having. So previously, when patients go to ER, what happened is when the patient is for admission, so the staff um, waited for patient's laboratory before rooming them in. I mean, before going to the floor. So now we've noticed with regards to the feedback given by patients, and then with regards also to the rationale of why waiting, that kind of thing. As long as it's not something that needs to be addressed really in ER per se, then why not transfer the patient right away after things has been processed, after the rapid antigen test results are out. So that's actually what we did, because we had a meeting, and how to improve things, this and that, based on the feedbacks. So we actually did that, and yeah, I see the um, improvement based on the, how do you call that, the patients kuan ba, the not just the quality but the service bitaw given to them,
Yes.
uh, unlike before. And then aside from that, we can also cater more. So instead of having a pool of patients in the ER waiting for the results, since we moved them into their rooms already, then we can cater more patients, coming to ER.
Yes.
That's all, Ma'am Jess.
Thank you, Ma'am Rod, for that. Yes, Ma'am Em.
In our case naman, kasi ang amo man gud is doctor and nurses set up ba. So we do the procedure, but the doctor will read the result, no? They make the result. Sa amo, kuan man gud daghay comment before na ang amo results ma-release dugay kaayo, but the thing is dili namo siya fault nga dugay ma-release ang result. It's the doctor who return the results ang dugay. Dugay ang turnover sa results kumbaga. So on that
Yes.
evaluation, our head doctor advised and tell all the affiliated doctors na ang ilaha reading should be, like say for example sa ECG, no, the reading should be only 24 hours since nakuha kato siya na strip for the ECG. Kay mostly syempre kuhan kag ECG meaning there's something wrong with you na need
Yeah.
mabasa dayon. But sa amo, before ka na siya ma-implement na dapat within 24 hours na na-reading, ang mahitabo man gud is mudagan siya 2 to 3 days, mostly minsan 1 week pa before mabalik ang ECG. So mahitabo ana namatay na lang ang pasyente, wala pay
Oh
reading.
my.
So after sa kuan kanang implemented na rule no sa amo doctor, sa amo head doctor, na dapat within 24 hours, especially kung inpatient, dapat na anay result. So on that, nindot na kayo siya release sa results, mas madaghan mig patients na makater in that kay dili magpatong ang amuha mga ah,
Yes.
papers and documents sa amuha unit. So I think that's a very very good plan para sa amuha department.
Yes, ma'am. That's nice. Kay timely na no ang mga results. It would be ironic na kuan siya og ECG and late na mahibaw-an nga MIDI or
Yes,
any
ma'am, yes.
cardiac cases nga need og
Oo.
immediate attention. So,
Oh, especially sa mga echocardiogram pod siya na kuan. Ang amo time dapat is at least 3 days, 3 to 5 days na anay result. Kasi syempre echocardiogram is a diagnostic, 'di ba? You try to identify if there are any cases no related sa heart sa patient sa iyaha current case karon sa amo amang good ang turnover mo dagan gid siya week minsan months pa. So very good na gi-implement to sa amo new actually siya, new head doctor sa amo unit na dapat kung ECG within 24 hours na ang result. Then dapat ang echo at least 2 to 3 days na anak kay they are all diagnostics. That's very important in identifying, 'di ba, the cause or the reason behind nga na nasa hospital ang amo patient.
yes. Yeah, so that's where turnaround time is developed, no? Kay nanatigi require nga
Yes,
time
ma'am.
from getting the actual examination to receiving the result. Yes, thank you for that, Ma'am M. Now, let's proceed to our next topic, which are the principles of quality improvement. So, there are also a number of principles that some of the organizations have um, enumerated that help their planning, and these are the common principles that I have seen. So, there has to be
Giselle,
yes, yes, Doc.
um, let's make sure that we can limit our time. Please be conscious with your time so that we can also cater the second reporter for this year.
Yes, yes, Doc.
Okay, thank you.
Thank you. So we have the commitment to quality, wherein everyone in the organization needs to be committed to providing quality services and continually improving the quality of services. So it is difficult for an organization to be um, united with a plan. No? So it's where we start with our plan na isa lang atong goal. So another principle is the culture. An organizational culture where mistakes are seen as opportunities of improvement rather than punishment. So a change has to be accepted by the organization in a positive manner. And that's how a QI team helps, or us leaders, managers in the organization, help to develop this uh, kind of culture. Then another principle is customer focus. So plans need to needs a customer needs are identified and understood, and their choices are identified and well communicated. So in a form of feedbacks we get from our clients, this is where we see the things that we need to improve for, because we are health services are there because of our customers, because they are the ones who need our services. So for work as systems and process, so let's first differentiate what is systems, what are processes. So systems, a system is a group or combination of things or parts forming a complex or unitary whole, and it is a methodical way that you provide specific goods or services to your customers. Then a process is all the related activities inside a system. So a process is part of a system. It is a moving part of a system. And it is a sequence of activities intended to produce a particular result. So processes are part of a system. So system is as a whole. So we need to part focus on being part of the team. Successful quality improvement efforts usually incorporate a team-based approach to achieve long-term meaningful improvements. So next one is focus on the use of the data. So we have these assessments, we have these feedbacks from our clients, and both quantitative and qualitative data are essential to assessing the success of quality improvement efforts and providing guidance for initiative modification. So these feedbacks that we receive from our clients may be positive or negative. We need to have them for the improvement of our plan and for our organization. And also, we need to focus on patient. Quality improvement efforts should address the needs of the patient by targeting patient access safety and promoting patient engagement. So, um, our patients are the reasons why we have conducted these services, why we have planned this kind of services. So they should be also a focus of our plan. So this is the last question. If anyone could answer, what do you think are the most common uh, barriers to quality improvement? I think I have to answer it myself. So that I'll pass on the floor to Ma'am Kim. So what I usually observe in the setup where I have is that a common barrier is sometimes the administration who are less supportive to their plans, the budget, especially for those small organizations, and um, I believe also the lack of knowledge of the staff on the importance of change. So that's a few common barriers that I have experienced. So that's for my part, and thank you for listening. I'll pass on the uh, floor to Ma'am Kim for the
Right.
next topic on the road. Yeah. Ah,
Yes.
Yes.
okay.
Before we proceed to Kim, do you guys have any clarifications or concern in relation to the QIP? So basically, just to summarize what Giselle was saying in her report, quality improvement plan has something to do with a plan. And when you talk about plan, it has something to do with assessment, um, diagnosing, implementing, and also evaluating. And part of which is the entire plan should have a plan. Meaning to say, from the very beginning, you have to inject the plan from the assessment up until the evaluation. Diagnosing here has something to do as to identifying the certain problems after you come up with the goals and also the specific and general objectives of your plan. Most of our students in the master level, after they come up with a very good thesis, no, usually their output is a quality improvement plan for their hospital, no, or for the institution that they are um, utilizing in terms of the locale, no. Usually, guys, in a thesis, a plan should be produced by the student in order for us to determine as to what are the things that are being focused into your study, no. So if you were able to get the content as to what Giselle was saying, perhaps we can apply that one, no. And if you would like to look for a plan, no, for a specific sample, hopefully that we can somehow see an improvement plan, no, or whatever plan it has, no. It can be an enhancement plan, it can be a sustainability plan. Usually, it has been incorporated with a program, no, part of which is quality improvement, no. So